All attendees are in listen-only mode.
Hello, and welcome to our webinar on using health impact assessments to shape transit policy. My name is Karen Odegaard, and I am a community coach with the County Health Rankings and Roadmaps program. I am joined by my colleague, Kate Conkle, who will be helping answer your questions as well as sending out some links via the chat box throughout the webinar.
Hi, everyone. As Karen said, I'll be monitoring questions throughout the webinar, so send them in when you have them.
We are also excited to be joined by Jason Wilcox from the Columbia Boone County Department of Public Health and Human Services and Lisa Goldschmidt from PedNet Coalition. We'll talk with them in a bit. Thanks, Jason. We'll be talking with Jason and Lisa in a little bit about how 2 HIAs have impacted transit in Columbia, Missouri. So thank you so much for being with us, Jason and Lisa.
Thanks for having us.
Yeah. So first, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Foundation, the Robert Wood Johnson Foundation, and the University of Wisconsin Population Health Institute. Thanks to the support of the Robert Wood Johnson Foundation, we have 4 community coaches in the County Health Rankings and Roadmaps program, and our assistance is available at no cost to you. So please don't hesitate to contact us if you need assistance with a tool, a question, or just wondering about the next step in your process. We want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. So please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. We'll be sure to leave time for your questions toward the end, but again, we do welcome them at any time throughout the webinar. So here's a quick look at how we'll be spending our time together today. We'll start with a brief overview of the County Health Rankings and Roadmaps program to help set the stage for our topic today. We'll then talk with Jason and Lisa about their work in Columbia, Boone County, Missouri, and we'll be sure to take time for your questions to help you put this information to use in your community. We'd like to begin our webinars with an essential question that you can keep in your thoughts throughout our webinar today. We're going to be learning how Columbia and Boone County used a health impact assessment to shape transit policies. So today's essential question for you is, how can health impact assessments shape policies for improved health in your community? Before we talk through a brief overview of the rankings and roadmaps, we'd like to also throw out some reflection questions for you to consider. Who else do you need to share this information with? What is one idea for action that you're taking from this webinar? And what else do you need to know to take action to use this information? So these questions, again, can help you use this information in your community going forward. We want to also take a moment to see how familiar you are with the rankings model. So I'm going to launch a poll. And we call these our rapid response polls. We'd love to have just a quick glimpse at how familiar you are with the model that the rankings are based on. And we'll give you just a few seconds. See the results coming in. It's always interesting for us to see the mix of attendees that we have in our webinars and to share that with you as well, so you can get a sense of who's on the webinar today. And we'll give you just a few seconds more. Okay, great. So I'm going to go ahead and close the poll. And we'll share those results. So there are a handful of you who are new to the rankings model, so we'll take a look at that. Some of you are quite familiar with the model or have at least heard of it, heard it explained once. So we always encourage you to think about new ways that you can use this model, feel free also to share in the chat box what successes you've had with using this model, how it's helped you introduce maybe a new partner to health or to their role in health in your community. So great, thank you so much for sharing that. We're going to go over and take a quick look at some of an overview on the county health rankings. So the county health rankings rank the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes and one for health factors. We do this because there are two separate sets of messages to convey: how healthy a county currently is, our health outcomes, and how healthy a county might be in the future based on the many factors that influence health, our health factors. Because much of what affects our health happens beyond medical care, the rankings really underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure that our kids grow up healthy are top priorities. This picture shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how long and how well we live. Things like how we commute to work, availability of jobs, access to healthy foods and opportunities for physical activity, and our social connectedness all impact our health outcomes. So you can see that our topic for today, transit, sits in our model. And as we talk with our guests in a little bit, we'll hear more about how transit impacts many other areas of the model, including access to care, diet and exercise, employment, and family and social support. Starting from the bottom of this model, we know that effective local, state, and federal policies and programs can improve a variety of factors that, in turn, shape the health of communities. Today's discussion about transit policy will illustrate this point. Many health factors shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is: length of life and quality of life. So why do we rank? We rank counties within states to provide community leaders with a tool for calling their communities to action. When the county health rankings are released each spring, they garner a lot of media attention, which community leaders can then leverage to mobilize multiple sectors to get involved in taking action collectively. Action that is evidence-informed and focused on the community's health priorities. Action that will ultimately, over the long term, result in longer, higher quality lives for children and adults in the community. The rankings show us that where we live matters to our health and serves as a call to action, and roadmaps helps us move from awareness to action. The Take Action cycle is the how within rankings and roadmaps. It lays out the process communities follow to improve health. Gather information to assess needs and resources. Set priorities so that you can focus on what's important. Find the most effective approaches to address your priorities by choosing effective policies and programs. And then get to work on acting on what's important. And of course, evaluating throughout the cycle will help you improve your strategies and ensure that what you're doing is effective. You'll notice that communicate sits at the center of the cycle because communication with stakeholders is essential throughout the Take Action cycle. But at the heart of the Take Action cycle is people working together because we know solving issues like childhood obesity, poor high school graduation rates, or inadequate health care really requires the wisdom of people and the wisdom and resources of people from all walks of life. So we have another quick poll for you that will help us understand how familiar you are with the Roadmaps to Health Action Center. So I'm going to launch this. Again, this is another rapid response poll, so we'd love to have your input, just real quickly. What is your familiarity? How familiar are you with the Roadmaps to Health Action Center? We had a few notes from folks while we were going through that overview, and I'll just mention one of them notes that What Works for Health has been one of the great resources that they've used, and What Works for Health is a tool that we're not going to spend a lot of time with today, but I will just note that it is a great tool that sits over in the Action Center. So as we move over to that, we'll take a look at it. And thank you so much for offering your feedback. I'm going to close the poll and share it with you. So you can see, and this is pretty common, we're really working on getting the word out about the Action Center and helping people connect with the Action Center and the tools that are available there. So there's a good handful of you who are not familiar with the Action Center, some of you who have heard of it. A couple of you have taken a tour of the Action Center and started to use those tools. So as you think of it, if you have an experience with a tool that you'd like to share with us, please, again, include that in the chat box. We'd love to hear from you, and we'll share that with others. And as I said, we did hear from somebody who has been using What Works for Health, so we'll take a look at that in just a moment. So let's walk through a little bit about the Roadmaps to Health Action Center. First of all, there are 4 principles to roadmaps. It takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible from data to action and not get stuck in paralysis by analysis or drowning in data. So we encourage communities to look to the evidence to inform these actions, and if you innovate, be sure to evaluate. We want to keep focus across the health factors, including social and economic factors. And don't be afraid to take on policy systems and environmental change, which will create the greatest long-term change in health for the children and adults in your community. The Roadmaps to Health Action Center is designed to help communities fulfill those 4 principles and move through that take action cycle that we walked through in just a moment ago. So if you go to the Roadmaps part of our site and to the Action Center, which you can see there's the drop-down menu on your screen, you'll notice on the left there's the Action Center and then What Works for Health. What Works for Health is a collection of nearly 300 policies and programs that are rated by their evidence of effectiveness. There is a 4-minute tutorial on the What Works for Health page, so please check that out and start exploring what policies and programs you might use in your communities. The Action Center offers step-by-step guides for taking action to improve health in your community, as well as guides for each type of stakeholder involved in taking action. So again, we encourage you to go into the Action Center. I think Kate's chatted out a link directly to the Action Center. Go ahead and explore that, and remember that this is an interactive site. So along the action cycle, you can click on any step and move into a guide for that step to explore a little bit more of the tools and the guidance that's available for you there. We're going to turn now to our guests to learn more about health impact assessment, a tool that cuts across the take action cycle by helping assess needs, informing policy decisions, and encouraging community engagement and communication. So I'm pleased to be able to introduce Jason Wilcox and Lisa Goldschmidt. Jason is a senior planner at the Columbia Boone County Department of Public Health and Human Services. In this role, he is involved in many activities related to National Public Health Department accreditation, including mobilizing for action through planning and partnerships, which many of you may know as MAP. He's also involved in workforce development and performance management and quality improvement. Lisa Goldschmidt is the coordinator of the COMET campaign for the PedNet Coalition. COMET stands for Columbians for Modern, Efficient Transit and is focused on increasing and expanding public transit services in Columbia, Missouri. She has a master's degree in environment and behavior from the University of Missouri and is a healthy home specialist credentialed by the National Environmental Health Association. Lisa has also been involved in several community action projects related to the betterment of citizens in the city and region. So welcome, Jason and Lisa. Thank you so much for being with us. To get us started, can you first set the stage for us a little bit and tell us a little about Columbia and Boone County?
Sure. Thanks, Karen. Thanks again for having us today. So the Columbia Boone County Department of Public Health and Human Services is a city-county health department Also with the Human Services Division, the department has an appointed Board of Health which advises elected officials regarding policy recommendations in the interest of public health. We also have two other public health commissions, the Substance Abuse Advisory Commission and the Human Service Commission, and they also advise our elected officials on those respective topics.
A little background on PedNet. PedNet Coalition is a nonprofit member-based coalition founded on Earth Day in 2000, and we promote active transportation through advocacy and educational programming. We work to make it easier for people to walk, bike, use wheelchairs, and public transit. We are based in Columbia, Missouri, and we work both locally and in our community and nationally through the consulting services we offer across the country. The Comet campaign was launched in the spring of 2011 with the goal of tripling transit service in Columbia in 3 years.
So let's talk a little bit about our community here, Columbia, Missouri. So as you can see, Columbia has a population of over 115,000, and you can see a breakdown of our city demographics there on the slide. We have 3 institutes of higher education located in Columbia. The first is the University of Missouri, or the state's flagship school, and this is the city's main economic driver. Also located in Columbia is Columbia College, a 4-year liberal arts college, and Stevens College, which is the second oldest private women's college in the United States. The city is highly educated, with almost 94% of residents holding a high school degree and 50% holding a bachelor's degree. Columbia was recently ranked the 3rd best small city for jobs by Forbes and has a 6-year job growth rate of almost 10%. As a result, median income is around $43,000. Columbia has a thriving healthcare infrastructure, and sort of supplemented by the work that we do here at the department with our other community partners, it has helped us rank 7th out of the 115 counties in Missouri in the 2014 county health rankings.
Great, thank you so much. In Boone County and the City of Columbia, you were able to use health impact assessment to bring health into the conversation about transit and transit policy. As a result of this work, Columbia Transit is actually relaunching its service in August. So can you tell us a little bit about what changed as a result of your work?
Sure. If we can go to the next slide on the Columbia Transit System. So what we're looking at here is a map of the current system that we have that will be changing on August 4th. Our current system is a hub and spoke model, and what that means is that all transfers occur at a central location. Current headways for our transit system, which really equates to the amount of time you wait for the next bus to come along, is anywhere from 40 to 80 minutes, and that's largely because of the hub and spoke model, because the routes all begin and end at this central location that's in downtown Columbia. One of the top complaints we've heard about our current system is that it's inefficient, and there's a lack of coverage in certain areas of the city, primarily in the areas that have experienced a lot of growth in recent years. The current route design makes it really difficult to reach some essential services such as grocery stores, major employers, and healthcare services. So the map we're looking at now is of the new routes that, as I mentioned, will begin on August 4th. And our entire system has been revamped from the hub and spoke model to what's called a network model. And what that means is that now, instead of transfers occurring at the central location downtown, transfers will happen along the route. So what we're looking at here with the map on the left shows an overall map of the new system. There are 2 routes. The black route and the gold route are connector routes, and they run east-west and north-south along the major thoroughfares through the city, and they will cross each other on the University of Missouri campus in front of the Student Center. And that's a great location because thousands of students are there every day, and they can better access the entire city. In addition to the core connector routes, we also have 7 neighborhood routes that feed into them. The neighborhood routes, and you can see an example of that with the picture on the right, feed into the connector routes. And the neighborhood routes are designed so that riders can remain on that particular route and access activities and services they might need throughout the day, including shopping, medical care, recreation, schools, and government services. In addition to the neighborhood routes, we will also have a downtown orbiter route that will serve all 3 college campuses in our downtown area, and a commuter route up at the very top in the aqua color will serve an unincorporated area just outside the city limits that includes a halfway house and a pocket of low-income families. And we'll talk a little bit more about that particular route later. The new route design will result in much shorter headways, so we're cutting them down from 40 to 80 minutes to now they will be 15 for the connector routes and about 30 minutes for the neighborhood routes. And in addition to a complete redesign, Columbia Transit has also rebranded itself as Como Connect, and marketing materials for Como Connect, such as the example you see on the right, have been designed with a key legend that includes the services that are available on each route.
Thanks, Lisa. That's just a great change that you'll be experiencing starting in August. So it's really exciting to hear about the changes that you'll be seeing and the improvements to the system. So let's talk a little bit about how you got there. How did a health impact assessment, which is commonly referred to as an HIA, help you get to this success? Can you just talk a little bit about, first of all, what is an HIA and how has it helped you?
Sure, Karen. So as you mentioned, health impact assessment, or HIA, is an evidence-based tool used to inform decision makers and stakeholders about the potential health impacts of a pending policy, project, or plan. It is used before a decision is made or a policy is implemented. And although it is not an advocacy tool, it is important to have representation from groups with a stake in the decision or who serve populations who could be impacted by the decision. So in the United States before 2006, there were only about 26 HIAs that had been completed. Since 2006, we've seen over 200 that have been completed or in progress. And typically an HIA is done in 6 steps that you see on the left-hand side of the screen there. The first step, which is screening, determines the value and the need for an HIA. If the potential health impacts of the policy or project are already clear, an HIA won't add much value to the decision. Scoping is the second step. Scoping identifies the community that is impacted, including the vulnerable populations, key groups, and agencies with a stake in the decision, what research methods you would use, and the potential health effects. Assessment is carried out first in 2 steps. First, by gathering baseline data before the policy, project, or plan goes into place, and then using mixed methods to predict potential health impacts. In the 4th step, feasible and actionable recommendations are made to promote positive health impacts and mitigate any negative health impacts that you found during the assessment. An HIA typically results in a report which is made available to the community, key stakeholders, and other impacted groups. The final step, monitoring and evaluation, tracks the impact of the health impact assessment on the decision-making process, health outcomes, and it also evaluates the HIA process against a set of practice standards. Although HIA looks very linear in process, you may find yourself going back and refining previous steps, such as scoping or assessment. For example, scoping might lead to brainstorming potential recommendations, which are refined in assessment as you gather the data before they are finally finalized in the recommendation step. So for us, HIA was a tool that really allowed us to bring health into the conversation about public transportation. 2 of our proposed recommendations in the HIA were used. The first was an ordinance change by the City of Columbia to consider a member of the business community to serve on the Public Transit Advisory Commission. The other recommendation, maximizing access to employment, health care, and healthy foods, was used by Columbia Transit to build their neighborhood routes that Lisa spoke about previously.
All right, thanks so much, Jason. This is Kate. First, we have a big shout out from one of your fellow Missourians, Barbara, so I thought I'd let you know that, a little state pride there. But we also have a question that came in as you were talking. So you mentioned that the first step is screening to see if health impacts are already part of the policy. So in this case, what were the health considerations that you wanted to explore with Columbia's transit policy?
Sure. So basically our group, along with PedNet, kind of sat down and brainstormed about how expansion of Columbia Transit would impact identified health determinants. We chose physical activity, access to health care, employment, and healthy food, and also social capital or social interactions as the primary health impacts that we felt would be changed by expanding Columbia Transit. And basically how we did that was we came up with a pathway diagram, and this sort of looks like a logic model. So you would put the policy or plan on the far left-hand side, kind of draw the arrows out from there on how, in the short term, it would change physical activity, how would it change access to healthcare and employment, what are sort of the intermediate impacts of that change, whether they are positive or negative, and then you ultimately link that out to long-term health outcomes.
Great, that's really interesting. Thank you so much, Jason. And I would just point out that Kate did post links to both of the HIAs that Columbia Boone County has done. So if you want to go in and take a look at the actual example that Jason is referring to, you'll find those in that chat box. So take a look at those. So an HIA basically is systematically judging the potential and sometimes unintended effects of a policy or a program, a project of some sort, on the health of a community. And Jason, you noted that this is not explicitly, it's not an advocacy tool. But Lisa, can you talk a little bit about how PedNet Coalition used the HIA?
Sure. So the first HIA really helped us hone our message in terms of what we advocated for. Knowing that the findings indicated a positive potential health outcome for expanding transit, COMET and supporters made recommendations to Columbia Transit, now Como Connect, that the new route designs provide access to, for example, major employers, healthy food options, and medical care. As we previously talked about, Columbia Transit carefully considered our recommendations when they designed the new Como Connect route system. The second HIA on a transit utility fee helped us to know what not to advocate for. Since the key findings indicated potential negative health outcomes for fixed and low-income households if the utility fee were in fact instated, COMET has focused on other ways to increase transit funding. We've advocated for shifting funding for new road construction to transit projects that will increase coverage, provide longer service hours and Sunday service, and provide free fares. And in that vein, our City Council recently voted to allow free fares for all K through 12 students. Previously, fares for this age group were only free for children age 5 or under. The two HIAs have been invaluable tools for us for educating policymakers at the local and regional levels, and as well as the general public about the benefits of a well-designed transit system. We've used that information to advocate for increased transit funding from our City Council and from CAPSO, which is our local metropolitan planning organization, or MPO.
Okay, great. So we're getting some more questions coming in, so I'm going to give you another one now. And this is from Eileen in Akron / Summit County, Ohio. And they also have a transit center currently where everyone must go as a, the hub and spoke system, it sounds like. She would like to know how long the whole process took to get to the development of the new system with a core and neighborhood routes.
That's kind of an interesting question. It's something that Columbia Transit had actually been thinking about for a very long time, and they received a go-ahead about a year ago to redesign the transit system. But since they had put a lot of thought into it beforehand, it came together pretty quickly. And one thing I'd like to say, too, is that with the new system, this is revenue neutral. It doesn't cost anything to the taxpayers. It doesn't take anything additional out of their budget to do it. So we're really pleased that they were able to come up with a solution that met a lot of what we had identified as needs to promote health in our community, as well as not spend any money to do it.
Great, thank you so much, Lisa. We have a couple of other questions that have come in asking a little bit about getting people engaged in this process and how have you done that. And I'm wondering if you can just talk a little bit about what kinds of challenges have you encountered in this process, and how did you go ahead and get people engaged in doing an HIA and following your recommendations?
Well, I think the biggest challenge for us here at Columbia Boone was just building capacity to actually carry out the HIA. I was actually able to attend the inaugural HIA meeting in April of 2012. And at that conference, I followed what was called the HIA 101 track. and that was basically a track that went through each step of the HIA in detail. And so from there, when I came back, I essentially had to teach our group in Columbia what is involved in each step, what the processes are, what data we need to go find, and so forth. We were able to actually receive some technical assistance for our first HIA, which was definitely a big help. And at the end of both health impact assessments, we did a process evaluation, and we've identified some areas that we would like to improve on as we continue to carry out HIAs here in Columbia. I think another big challenge we faced was really just getting buy-in from other sectors. So we had our immediate partners such as PedNet really already bought into the process, but the HIA tool is just so new to Columbia that nobody had really seen it or heard of it before. So what we did was schedule stakeholder meetings with our community development director, our city manager, city council members, public school administrators, among others, really just to talk about what an HIA is. And then we were also able to host a half-day workshop and invited a lot of these other community stakeholders to go through more of the steps in detail.
All right, Jason, sorry, just monitoring lots of questions coming in right now. So we have another question that, given the challenges that you faced knowing what you know now, is there any prep work you would recommend people do so that when the time comes to do an HIA, they're ready to roll?
I think really it's just sort of doing your homework. And I've posted some resources that I felt were very helpful to me, having not ever done an HIA before. They're on the right-hand side of the screen, starting with the very top one, the Health Impact Project. It is a collaboration between the Pew Charitable Trust and the Robert Wood Johnson Foundation, and it's sort of a home to all the health impact assessments that have been done in the United States. They have an interactive map you can search from. You can search through different states, find if there's been any that have been done in your area. You can search by sector, so if you're looking at a transportation policy or somewhat, you can sort through HIAs based on that. Human Impact Partners was another great resource. They are a nonprofit based out in Oakland, California. They were, a group that had really been sort of the cutting edge people in HIAs in the United States. They were the first group that really started to do HIAs. They have a lot of user-friendly materials up on their website, so I would definitely check them out. The National Research Council authored a book called Improving Health in the United States, The Role of Health Impact Assessment. Very valuable resource to have. I highly recommend that book. It goes into depth really on each step, gives you sort of a health and all policies feel to it as well. And then the Centers for Disease Control and Prevention has put out a toolkit that gives you some areas of data to go find. So I think, using those resources, and there are many more out there, really just sort of doing the groundwork before you decide to do one.
Great, thank you so much, Jason. And we've had a couple of questions come in about how your transit agency was involved, how public health professionals were involved. Can you just talk again a little bit more about some of the specific stakeholders, especially those key ones, the transit agency and public health, and how they were involved in this process?
Sure. We definitely made it a point to reach out to our transit agency. They were a huge help throughout the entire process. Really, we wanted just to bounce everything off of them. So as we were doing the research, coming up with recommendations, we really wanted to reach out to them and say, are these feasible? Are these the types of things that you've been seeing really across the country? So without them involved, we've sort of been really just kind of blind without them. And then certainly with public health, this is something that our department has been very excited about, is sort of this health and all policies. So we had a lot of key just buy-in from our management staff, really letting other city departments know what health impact assessments are, how we could potentially use them, and sort of creating that buy-in from other city departments.
Great, thank you. So we started out today talking about Columbia's transit redesign, which is an incredible win for your community. But I wondered if there have been other outcomes from using an HIA.
Yes. It's really been a catalyst for us to be able to open up conversations and create new partnerships in transit planning, which was one of our goals. So in addition to working with Columbia Transit and the City Council on transit expansion, COMET was able to facilitate discussions that included those two partners plus our county commission. And together all these groups worked to find a route outside the city limits that will serve an area that's largely populated by low-income households and a halfway house. And they have previously been cut off from transit services. This is the first time that the city and county have partnered on transit planning, although they have partnered in other areas. This is the first time for transit. And with the success of this effort, the county is now looking at where other routes might be added and how to fund those routes. It also helped to shed light on some information that really might have been missed if you just look at county health rankings alone. Although Boone County is the 7th healthiest county in the state, there's still work to be done. Conducting the HIAs allowed us to better focus on a transit system that benefits everyone. So for example, we learned that although we have some of the best healthcare facilities in the state, that people sometimes forego doctor appointments due to a lack of transportation. So working together, we now have a better transit system that will provide wider access to those services.
And I think just to second what Lisa said, so through all these partnerships and discussions about transit, we've really seen that there's a demand for this tool, this health impact assessment tool here in Columbia. And in fact, I will be meeting with our community development department here at the city in the next few weeks to screen some potential HIA projects while the City of Columbia is implementing some of their pedestrian infrastructure that they identified within the city's comprehensive plan.
All right, thanks again, Jason and Lisa. And again, lots of good questions coming in. So it seems like you've had a good response and have been able to really use this to build a good partnership with decision makers in your community. We're getting some questions around, it sounds like in some communities, decision makers see HIAs as a tool that's going to slow things down, and also they're just a way for the health department to try to advocate for what they want. So how are you able to get your decision makers to see the value of the HIA?
Sure. So I had mentioned in a couple slides ago that we did some stakeholder interviews with sort of key departments and other agencies throughout the city. So really we just tried to get out, I guess you could say, get out in front of their questions. So within those stakeholder interviews, we sent a flyer, sort of a one-page flyer to them about what a health impact assessment is, some of the projects that it's actually been used on, gave them a couple days to review it, and then we met with them and then really just kind of talked in depth about what questions they had. You hear some of the criticisms that say HIA is costly, it'll slow down economic development, it's too time consuming. So it was really just to sort of get out and educate them that, really it just flows with the policy or plan timeline. It's not to say don't do that, it's just to say if this is going to be implemented, you might want to think just a little bit about some of the potential health impacts. And we were also invited them to our workshop, so giving them that hands-on really of what an HIA is and being able to talk to some of our technical assistance providers really helped answer some questions from our end as the health department.
And I think, too, to add to that, when you look at health, it's a really great equalizer, and being able to talk about all these factors that go into our overall health in one document is really a great way to communicate a message to decision makers, and that we aren't getting siloed in our policy decisions. For example, we just look at land disturbance and how does that affect people, or we look at housing, or we look at whatever factors may be. A health impact assessment really combines all of those because there's so many of those that touch on our overall health. For me as an advocate, I think it actually streamlined things in that we were able to encompass a lot of different factors into one and talk about overall health and how transit planning would affect that.
Great, thank you very much. We're going to move into more audience Q&A in just a moment. I want to turn back to our reflection questions and just remind folks to kind of be thinking about who else you might want to share this information with. And what is one idea for action that you're taking from this webinar? And please feel free to chat those to us. We'd love to see how you'll be using this to take action and who you'll be sharing this information with. And then we can share that with the larger group to just continue to help people think about how they might use this. We've got time for some more of your questions, and we have fantastic questions that have been coming in throughout the presentation. So just think about what else do you need to know to be able to take action to use this information. And again, just fantastic questions coming in, so we really appreciate the thoughtful questions. And I'm going to turn to Kate now to see if we are ready with a question for you.
Yes, lots of questions coming in. So we're going to start with one. I think at some point you mentioned, I think it was you, Lisa, that this is a budget-neutral process. So we have a listener that is wondering how this was achieved as budget neutral. What was the business case for stakeholders? And a question about public versus private. I'm not sure what that part means, but maybe you do.
I'm not completely sure. I will say that in terms of budget neutral, that's just the transit redesign is budget neutral. So that does not take into account the HIA and the cost. I'm having some technical difficulties, I think. Can you hear me?
We lost you for a second. Try that again. You're back now.
Okay, thanks. Sorry about that, everyone. So what I was saying was that in terms of the transit redesign, that's what was budget neutral. So that did not take into account the costs associated with performing the HIAs with regard to transit. And in terms of how they did that, if that's the question, they just took a real hard look at where the inefficiencies were, and with the recommendations provided by the HIAs and the comment campaign and other supporters, they were really able to take a hard look at what they could do and how they could best use the dollars that they have. And I hope that answers the question.
All right, thanks, Lisa. I think that makes a lot of sense, and I think that's a great answer in terms of, there's not always HIAs, other tools don't always spit out an easy answer and make things just give us more money or tell us how to do it better. It is that taking a hard look at what resources you have and how to use them better. So we're getting a couple of questions related to engaging the communities that are most often impacted and with the biggest health disparities, and both how you advertise the stakeholder meetings to encourage diversity and involvement, and how you are able to reach those different communities.
Sure. So we actually had a third agency that helped out with both health impact assessments, and they are Central Missouri Community Action. So they were a local community action agency, and they're really focused on populations here in Columbia that are in poverty. So they really were our connection to these groups, because like I said before, it's not an advocacy tool, but you do need these types of groups and stakeholders at the table. So we really leaned on them to sort of let us know where we needed to go, find these different populations, how best to advertise for them. They helped us gather up some primary data. So instead of doing an online survey, we did pen and paper. So really having those groups that work with these populations on a daily basis is a huge benefit, especially when you're talking about groups that are often, sort of bear the brunt, so to speak, on policies.
Thanks, Jason. And we are hearing from some of our webinar attendees that they are planning to share this information with their transit systems, whether it's a regional transit planning group or a transit system, and also their regional planning commission folks. And I think that makes a lot of sense. Some people are talking about sharing it with their colleagues in public health. So I think that those are all, you can hear the stakeholders that were involved with the HIAs that happened in Columbia and Boone County, and you can kind of think about those stakeholders may be good ones to share this information with in your community.
All right, and we have another question, Jason, from another planner. Josh is a planner that is not very familiar with HIAs at this point, but is wondering what methods did you use to collect data? Did you do primary data collection on health factors? Did you use any transportation or land use models with the collected data?
Sure. So as I mentioned before, HIA is really a mixed methods tool. So we started off by doing literature reviews for each one of those health determinants, so looking at physical activity and sort of the access issue, and really getting sort of a broad look at what's happening across the United States. And then from there, we kind of tried to bring it down to our level. So we did some primary data. We were able to do a local survey with people that rode transit, found that they used Columbia Transit, to find employment, to find healthcare and things of that nature. And we also had actually it was Comet and PedNet that hosted a sort of some focus groups, conversations about transit in 4 of our 6 city wards, and really brought a lot of stakeholders to the table with that as well. We unfortunately didn't get to do any of the modeling, but that's something that I would really like to do in the future, especially having now talked with our transit agency a little bit more, and some of the community planners here as well. It's an option that we'll definitely have in the future.
All right. So Jason and Lisa, I know that you've addressed this in a couple of different ways, but I think just because this is a hard topic to wrap your head around sometimes, and partnering with maybe some non-traditional partners who are resistant to a process can be challenging. So people are still looking for any suggestions on how you can, so this person says that they're in the initial stages of planning and they have multiple municipalities on board, but there's one that they are really just challenged with and aren't really willing to participate and engage in the process. Any suggestions on either moving forward or how to maybe engage those who are more resistant to this?
I think in terms of, I think I heard the question correctly. They're trying to involve multiple municipalities, and there's one that's resistant. Am I hearing that correctly?
That's how I'm reading it as well, yes. So Chester, if we're not reading that correctly, let us know. But yes, that's how I understand it too, Lisa.
I think in terms of moving forward, you can keep trying to educate the municipality that is resistant. But I think at some point you just have to move forward with what you're doing and hope that the success of your work will actually bring them along. In terms of our campaign, we've had resistance from some sectors, and that was one of the things we talked about. At some point we have to move forward, and we have to move forward with whoever we think can help us get a win. So if you've identified groups and municipalities that can help you get a win for transit, then by all means continue working with them and continue to reach out to the municipality that is resistant. They may come along at some point. You might be surprised. But I wouldn't necessarily exclude this municipality. I would, again, keep trying to educate them. I think that's probably the most effective advocacy tool is education. And use whatever you find to be able to educate them and help them move forward with you. But unfortunately, not everyone is always going to do that, and you just have to make a determination within your own campaign or your own advocacy efforts as to what point you actually do move forward.
Okay, great. Thank you, Lisa. So here's hopefully an easy one, a question about, do you have a transit authority? So it might be helpful for people to have just a basic understanding of how your system is set up there a little bit, so as they're thinking about how they might take this to their own communities, they can see what avenues you are navigating.
Sure. Columbia Transit is not set up as a transit authority, which is has been a barrier in the past. So, for example, they were not able to have routes that extended beyond the city limits. and they were not able to even consider that as not being a transit authority. So that's what led us to try to work in cooperation with our county commission in order to have a route that goes out into the county beyond the city limits and actually serves low-income populations.
Great. Thank you so much for explaining that a little bit more and giving us a little more context there. I want to note that we have we've chatted out throughout the course of the webinar links to the HIAs that that Columbia Boone County did. We've also chatted out a link to a story, and I'm just about to chat out a link to another way that you can learn a little bit more about PedNet Coalition as part of our Roadmaps to Health community grants. We have some additional information there about the PedNet Coalition, so lots of opportunities to dig in and learn a little bit more about PedNet and their work in Columbia and Boone County. We want to thank our guests. We're wrapping up now, and we just want to thank you so much, Jason and Lisa, for all of your experience and your insights you shared today, and we really appreciate the richness of your experience and your work in doing HIA and bringing health into the conversation around transit in Columbia and Boone County.
And definitely thank you to all of the participants for your great questions today. It definitely makes it more interesting to have you engaged and involved, and we appreciate your thoughtful conversation today.
Absolutely. And we always encourage you to stay connected with us. You can follow us on Twitter. You can like us on Facebook. And if you're not already signed up for our e-newsletter, you can go ahead and email us at chr@match.wisc.edu and subscribe to our newsletter there. We have a number of people who help make the county health rankings and roadmaps possible, and so you'll see many of those folks listed here. Some important partners and contributions from here in Wisconsin at the University of Wisconsin Population Health Institute, but also the Robert Wood Johnson Foundation, and our partners who help us collect the data and get the word out about rankings and roadmaps. We started with an essential question, and we hope that you feel that you have some answers and that maybe some even new questions to take with you about how you can use health impact assessments to shape policies for improved health in your community. And again, we thank you so much for your participation during our webinar today, for your interaction, for your questions, and sharing your experiences along the way. And we look forward to seeing you again. Have a great afternoon.